Hi, hello and welcome back. I hope all of you are doing amazingly well. I'm Dr. Prashi Kaveri and in this video I'm going to give you information about Next, everything in and around Next. All my comment section in almost all the videos are filled with doubts regarding Next, and all the students in final year and even pre-final year students are very much bothered because they do not have a clear idea as to what exam they'll be giving after their internship, whether it's Next or it is NEET and whatnot. So in this video, I'm going to cover some of the points which are very much important for the students who are studying, especially in final and pre-final year, so that they can easily study their final year or the previous year exams. And first thing first, I'm going to talk about the phases in Next. So next is two phases, phase 1 and phase 2, similar to USMLE. Now coming to phase 1, this is going to replace the theory exams of your final year. So you're not going to give any theory exam in your final year. Instead, you will be giving step 1, or you're going to be giving phase 1 of Next. And you also have your practicals along with it. Now you need to score above 50% in every subject so that you're eligible for internship. In case you haven't scored 50%, even in one subject, you'll have to give a supplementary exam for the same, clear it, and then continue with your internship. Now after your internship, you're going to give your phase 2 of Next. In phase 2, they're going to test your practical skills. So during internship, you'll have to build on your practical skills, all the examining skills, and that will be tested in phase 2. And in phase 2, they're not going to give you marks based on how you examine. They're just going to tell you whether you're pass or fail. That's it. Now coming to who are all going to write Next, there are a lot of people say that Next is going to be implemented for the batch 2019, but none of us are sure for 100% regarding the same. But I urge every student to be prepared in the form of case scenarios or in the form of exam oriented case discussion while studying, so that you will not be in trouble in case Next is implemented for your batches. Now coming to the question pattern that comes with Next, they say that 60% of the questions are going to be very moderate range questions, that is, they're all going to be normal. 30 questions are going to be mid-range questions, and 10% would be higher range questions, and only if you put in lots of effort in studying you can solve all those questions. Now coming to what a student should do if they are given with Next. See, what happens is that whatever may be the exam, the content is same and the important topics are same and the treatment is same and everything pertaining to that topic is same. So studying a concept in depth should be the prime intention of any student. You going to practicals, going to your clinicals will become very important, because after you go there, when you see the patients and examine, you will get to know how a patient presents with a particular disease, so that you can go back and study in that regard, so that it will become a retrospective learning and it will help you while answering next questions, because almost all the questions are going to be clinical scenario based. Third most important thing is that you need to fix, or you need to stick on to important studying tools like Marrow or PrepLadder, and studying your standard textbooks should be the norm. Now during COVID times, even I did not stick on with my standard textbooks, but having said that, if I had time now, I would really appreciate myself to go and read standard textbooks, because standard textbooks cannot be replaced by any other simpler tools. And if you're using simpler tools, you can just go give your theory exams and come back and nothing is going to be retained in your brains, because you wouldn't have understood the concept in detail. So especially when you're going to give an exam like Next, whichever batch you are in, if you are in final year, you do not have a lot of time to go and study all the standard books. That time you can really use some shortcuts. But if you're in first year or second year and your end goal is to go give Next, I think it is really wise for you to go and stick with the standard books and read standard books, so that you are thorough from the base and it is easier to build on later. Apart from standard textbooks, using some app is a must. Marrow is a really good app and you can use it for all the subjects, but especially if you are in final year or pre-final year, you can go with PrepLadder for especially first and second year subjects, because they have cut short every videos and they've given everything in like the important points are highlighted, so that you can finish it fast. But if you're in first and second year, you can go with any apps, whichever is convenient for you. And I would suggest somebody to go with PrepLadder for medicine or some other app for medicine, because even though medicine is very good in Marrow, it is very vast and a person really has to spend lots of hours in studying. And if you're in the final year or if you are in pre-final year, you wouldn't have that much time to go and study medicine. And none of us are like Anuj Pachal, that great to go and study everything from medicine. I couldn't do it. If anyone of you can do it, you study from Marrow. Otherwise, I think sticking to a simpler app for studying medicine would be a better choice. Having said all these, being positive is the key. I think if somebody has next, there are two advantages to the student. Number one advantage being, you'll have less competitors. Even though you're new to the exam and you're confused and all that, there are less people in your boat. But if you are giving NEET, you have so many batches of seniors who are competing along with you. If you're giving next, you're just competing along with your batchmates, so that it is easier for you to get a good rank if you have prepared. Coming to the second point, you need to study well only during your 4 years of MBBS. That even though if you're giving NEET also, you should have studied during your 4 years of MBBS, right? Now, after this 4 years of MBBS, your first step would be cleared. In internship, everybody is going to go build on their skills. You're also doing the same thing. So I feel like the study time is decreased so that you're going to get settled faster, you're going to clear the exam faster, and that also adds to one of the benefits of next. Coming to the demerits, not having proper information, like the clear-cut, crisp idea about next is only the biggest demerit of the same. But then just remember that all your friends are in the same boat, and it is not only you who is very confused about the same. So I think leaving that apart, if you just focus on learning the concepts in depth and preparing everything in the form of you going and giving an exam is very important. I think approaching every concept as a patient is the key, because when you see everything in the form of a patient coming to you for a diagnosis, I think it becomes easier for one to study. Especially not only for the students who are going to give next exam, I think for anybody who's in internship also, to see a patient and go back and retrospectively study about the case, it is very much easier for one to remember the case and also to remember the tests done and the clinical features very wisely and to a greater extent if this is the study approach. And this is what even I want to focus on later days. So having said all these, I think I have covered all the highlights of next. If you have any more doubts, you can put it in the comment section so that I can come up with one more video which will be an add-on to this video in case I have not spoken about it. And that's all. I think this video was helpful to people who are watching, and I think this is all that a lot of people know about next as of now, and we need to wait and see what new rules will come about the same and which batch will be implemented to in the actual sense. That's all. Until next time, bye bye.